Welcome, everyone. I'm Dr. Jim Metz, Chair of Radiation Oncology here at Penn Medicine. And we're going to have a wonderful event today. We had planned on having a celebratory event in person at Lancaster General Hospital, but obviously that's changed the times. So we're going to have a virtual celebration today and a really momentous occasion. We had delivery of the cyclotron, which is the large component for the Proton Center at LGH. It's a 200-ton unit that was delivered to LGH this past week, and also other equipment there. What's amazing is to transport this, we had to build a truck that was basically 4 tractor trailers long, 210 feet, to ship the equipment to LGH because it's so heavy, so we didn't collapse the roadways or the bridges on the way to LGH, which would have been a bit of a problem. But it's wonderful to bring us all together today. The group from Penn Medicine, at Penn Medicine, Lancaster General Hospital, from Bergen medical systems, have all come together to make this happen and make this technology come to southeastern central Pennsylvania. It has been an incredible working relationship with LGH, bringing together technologic experts from the Roberts Proton Therapy Center with people on the ground at LG that really understand their community to really build a special center out there. We'll be opening the center next spring, so in about a little over a year, and we really hope to have a live event at that time. You'll be hearing from a bunch of experts today and a bunch of contributors to this, but I'm going to turn it over to Randy Oyer, who's really been my partner in crime in this. We have been great partners in making this happen over the last few years. He's the medical director for the Ann Barshinder Cancer Center out there. So Randy, I'm going to turn it over to you for a few words.
Thank you, Jim, and thank you everyone for joining us to hear from our inspiring and inspired leaders, each of whom has something important to do with bringing Proton to Lancaster. But first, I'd like to thank you, Jim. Dr. Metz, you are a visionary leader upon whose work this Proton Center is being built. You made our health system a global leader in proton therapy, but I'm especially excited to bring a proton unit to Lancaster. This proton unit is dedicated to the people of Lancaster, to our patients and families in need, to our expert and compassionate physicians, to our donors, our supporters, our community leaders, and to everyone who will be helped by this wonderful new technology here at home. Back to you, Jim.
Randy, and thanks for those kind words. This is the first step in our vision for a hub and spoke model of proton therapy, with the Roberts Proton Therapy being at the center, and now Lancaster being connected directly with proton therapy for our patients. And I have to thank Larry Jameson and Kevin Mahoney, who really bought into this vision and allowed us to go forward with this. So I'm going to turn it over to Larry first for a few words. So thanks for joining us today, Larry.
Thank you, Jim. I'm really excited to be here with you today to celebrate this momentous occasion. We've been planning this proton facility for a while, but little did we know that it would need to arrive during the pandemic. And to see the cyclotron being installed in January of 2021 is really an amazing milestone. Penn Medicine is known for advanced medicine, and we're now able to bring this to Lancaster. Proton and the cyclotron is one of many examples, from the training of our physicians to working on the protocols for treatment with proton. This will be an incredible expansion of treatment capabilities for the Lancaster community. I'm super excited about the treatment capabilities at the Radiation Oncology Department. Proton is available to very few places around the country, but it's not the end. We see flash radiation treatment being studied. It can be used for a whole variety of disorders. And the ability to combine the planning, which is very sophisticated physics, with the treatment protocols in combination with chemotherapy and other types of treatment is very powerful. So now it's a real privilege for me to introduce someone who's been championing this project for many years, the CEO of the University of Pennsylvania Health System, Kevin Mahoney.
Thank you, Larry, and thank you for your leadership in making today possible. Penn Medicine, we have a team that is unrelenting in tackling cancer care, and I'm so pleased to be part of today's opening. I think adding Proton to the Cancer Institute at Lancaster General is going to be an inflection point in cancer care, not only in Lancaster, but across Penn Medicine. This has been a moment we've been waiting for, and it's where we take the absolute best of the science that we create downtown and bring it right to the patient's front door. They don't have to travel. They get to receive the greatest care available. And so many lives and grandkids and neighbors and patients and everybody in the community are going to benefit from today. And I'm just really proud to be part of it. I want to extend my really sincere congratulations. What other team but LG and Penn Medicine could open sophisticated proton therapy in the middle of a pandemic? Just thinking about the cyclotron making its way across the Atlantic Ocean up through the Chesapeake to Baltimore Harbor, getting on a tractor trailer that is beyond compare, making its way into the cancer center. It's just hats off and a salute to everybody involved. The other thing that I just want to make sure everyone's aware of, proton therapy is what we're talking about today, but this is really a reaffirmation that you got to keep the patient at the center of healthcare. And this is an example of a team coming together, collaborating. Physicists down at the Perlman Center connected with the team out at Lancaster General. Residents graduating from HUP, being trained in proton therapy, and then relocating to the community and living in Lancaster County and becoming part of the fabric. This is why Penn Medicine is dominant, will continue to provide great care because we put the patient at the center and we wrap them in all the services we have available across our great network. Many of you have heard me talk about my time I spent in Lancaster going to college and how much affection I have for the Lancaster community. And I just think it's terrific that a patient from Manheim Township, a patient from Peckway, doesn't have to drive to Hershey, doesn't have to drive to Pittsburgh, doesn't have to drive to Philadelphia, but can get the greatest care available right in the community. And this arsenal came about because of the research, innovation, and advancing science, which is the hallmark of Penn Medicine. And again, being able to bring it together with Dr. Oyer and all the physicians at the Barsinger Cancer Institute is just a tremendous testament to everyone's desire to make the world better and to beat cancer. And now I want to turn it back to one of our hosts for today, Dr. Jim Metz, a true leader in radiation oncology and cancer care, not just in Philadelphia, but across the globe. Jim has been an amazing scientist, driving force, and really the soul behind us advancing proton therapy. Jim is also the chair of radiation oncology and professor at the Perlman School of Medicine. So Jim, here's to you.
Thanks so much, Kevin. Thanks so much for your involvement today, and thank you for your partnership over the past 20 years to build the Roberts Proton Therapy Center into what it is today. We're very excited about what we've been able to accomplish over the last 11 years with the Roberts Proton Therapy Center. It's the largest center in the world. We've trained more people in radiation oncology, in protons in radiation oncology, than anyone in the world. 70% of people that are now doing protons are trained at the University of Pennsylvania. We've developed many of the clinical protocols. We've expanded the disease sites that are treated, and we really look forward to extending this to Lancaster General Hospital. I'm so pleased with the arrival of the equipment. It has been a multi-year process and many, many people involved. And I wish I could name everyone, but it's really been amazing to bring people together with this vision. It really is going to leverage everything we've learned at the Roberts Proton Therapy Center and start this center at the highest level, using our clinical protocols, using the expertise downtown, and marrying it with the expertise locally at Lancaster General. It's really an exciting time. This is new technology. We're partnering with Bergen for a new developing technology, a new gantry system. So we will be getting FDA approval with this. This will be first in the world technology at Lancaster General Hospital. We started treating patients over 11 years ago. We treated over 7,000 patients at the Roberts Proton Therapy Center at the University of Pennsylvania. We have defined clinical care for proton therapy over the past decade. Our team has opened new disease sites and new indications for proton therapy that were not existent 11 years ago. We're working on new ways to deliver protons, which I think will change the world in the future, which LGH is going to be an important part of in the future. Our partnership with LGH to bring proton therapy is incredibly important. We came up with a vision a number of years ago to build a hub and spoke model of proton therapy. Obviously, the Roberts Proton Therapy Center is the hub, but LGH is the first spoke in this model. to be the first single-room center in the community completely integrated with other radiation oncology equipment, completely linked to the Roberts Proton Therapy Center. This center will be completely integrated with conventional cancer treatments, with conventional medical oncology, surgical oncology, and radiology to deliver state-of-the-art care. I really believe it is the premier technology in the world, in the community, now at Lancaster General Hospital. So I look forward to this collaboration. I look forward to delivering care in the community and partnering with all the great people at Lancaster General Hospital to make this happen. As Dean Jameson said, an exciting, unique aspect of this project is we'll bring proton therapy to the community setting. And I know that benefit means a lot to my colleague, Mike Wegge, chairman of the Penn Medicine Lancaster General Health Board of Trustees.
You're right, Jim. Thinking back to when the board and I carefully reviewed the proposal, I recall how well conceived and exciting the plans for the Proton Center were. I'm so pleased with your tremendous partnership in bringing leading edge proton therapies to Lancaster. I'm so fortunate to occupy two unique leadership positions associated with our health system. My role as chair of the Lancaster General Health Board means I also serve as a member of the Penn Medicine Board and Executive Committee. It's an honor to serve and work with management and providers who all share a passion for the betterment of Lancaster and a commitment to the LGH mission of providing our community with the best healthcare possible. Lancaster General Health and Penn Medicine united in 2015 because we believed that together we would be stronger than we could be separately. Together, we've made meaningful strides in our ability to advance the health and well-being of the Lancaster community. The future Proton Center is another tangible example of working together to deliver the best possible healthcare options directly to our community. Lancaster General has over 125 years of investing in its people, its technology, and its facilities. This ensures people throughout South Central Pennsylvania have access to the most advanced healthcare services available. The capital investment in proton therapy is among the most significant we've made on behalf of our community's health and well-being, and will ensure that our region continues to have direct access to state-of-the-art cancer care. It's now my privilege to turn things over to Penn Medicine Lancaster General Health's President and CEO, Jan Bergen. As a leader in local healthcare for more than 2 decades, she holds a deep perspective on the important role cancer care plays in our community's overall health and well-being.
Thank you, Mike. I'm delighted to be with you today for this important milestone. You know, in cancer care, the capabilities that we are able to offer at the Ann B. Barsinger Cancer Institute are strengthened through its relationship with Penn Medicine's Abramson Cancer Center, one of the nation's foremost leaders in cancer research, patient care, and education. Part of the Barsinger Cancer Institute's vision was to offer a range of services that would enable comprehensive, state-of-the-art, compassionate cancer care while minimizing the number of people that would have to travel outside of Lancaster County for advanced oncology care. Today, expansion of clinical research, advanced therapies and offerings in personalized medicine are all working to expand one of the most extensive ranges of oncology services available in South Central Pennsylvania. Proton therapy at the Barsinger Cancer Institute is yet another way in which we will be able to supply a leading-edge Penn Medicine treatment, further elevating and advancing the depth and breadth of the services we can offer. When it comes to cancer treatment, we are developing and delivering the most innovative and advanced cancer services right here in Lancaster County. Now, here is someone who is a wonderful partner from Bergen, the maker of our Proton device, Colleen Kennedy.
Thank you, Jan. I really appreciate that. It's been Bergen's immense pleasure to be part of this incredibly exciting venture. At Bergen, we are committed to a world without fear of cancer, and we are truly honored by the decades-long partnership that we have had with Penn Medicine, encompassing joint innovation, clinical research, training, and education, as well as bringing new systems to market that revolutionize patient care. Most recently, the first patient in the world to be treated on the groundbreaking system Halcyon received that treatment at Penn Medicine. Now we're about to witness another first. The visionary leaders at Penn Medicine, the Barsinger Cancer Institute, and Lancaster General recognize that many patients want access to state-of-the-art cancer care, and they want it close to home. And so the Barshinger Cancer Institute is becoming the first center in the world to deploy Varian's new ProBeam 360 proton treatment platform, a system specifically designed to expand access to this life-saving technology while delivering the highest quality of care. At Varian, we never forget that the ultimate beneficiaries are the cancer patients themselves, whose lives are changed through access to this level of care. We know that the amazing medical professionals at Penn Medicine, the Barshinger Cancer Institute, and Lancaster General share this vision, and we're proud to partner with you to bring this latest technology to your patients in need. Thank you, everyone. And now back to one of your hosts today, Medical Director of Penn Medicine, Lancaster General Health's Barshinger Cancer Institute, a real visionary in cancer care, Dr. Randy Oyer, who will wrap up with some remarks.
Thank you so much, Colleen. Thank you to you and your team for helping us open Penn Medicine's newest Proton Therapy Center. The N.B. Barshinger Cancer Institute takes a careful and collaborative strategic approach that ensures the best cancer care for patients and families throughout our community and across our region. Our highly trained and experienced cancer care specialists use new therapies, new technologies, and clinical breakthroughs that benefit cancer patients in need. To that end, the Cancer Institute team provides personalized medicine. We get to know each patient and their family so that we can provide individualized cancer screening, prevention, and treatment, utilizing genetic and molecular analysis that provides precision diagnostic and therapeutic choices, including immunotherapy, targeted treatments, and proton therapy. The addition of proton therapy to the complement of radiation services in the N.B. Barshinger Cancer Institute completes the largest array of radiation services under one roof in one location in a community hospital in Pennsylvania. The Cancer Institute team continues to expand cancer treatment trials for patients because often a treatment trial provides the best outcome for an individual patient, as well as paving the way for future patients. Together, Penn Medicine and Lancaster General Health consistently provide the most innovative and advanced oncology services available for patients and families in our community and across our region.
I want to welcome Lancaster General Health to our Proton family. I am very excited to continue our collaboration in offering a new modality to the patients in your community. I know that we are already taking an incredible radiation oncology department and only expanding on its opportunities and offerings for your patients. So with that, congratulations, and very excited for our future.
Hello, Lancaster General Hospital staff. I'm Bill Lipscomb, Penn Proton alumni, just welcoming you to the family of proton therapy. Be blessed and be safe.
My friends and colleagues at LGH, hearty congratulations. It's so exciting that you now have the Proton equipment on site, and it's been really a pleasure to be working with you throughout this whole process, and we're so excited for you and to welcome you on board in terms of proton therapy. And just looking forward to future collaborations and really having this technology available for LG and for the patients in your area. Again, congratulations, and so look forward to seeing the center and continue to work with you.
Hi, my name is Timothy Beer, and I'm a medical oncologist at the N.B. Barshinger Cancer Institute. I am really excited that we are providing proton therapy because by targeting cancer cells with greater precision and minimal exit dose, we are able to minimize toxicity to surrounding healthy tissues. This not only improves quality of life both during and after radiation for many patients, but in some cases it also allows us to offer repeat radiation for recurrent cancers for patients in whom this otherwise would simply not have been feasible.
Hey everybody, it's Ken Blank, Medical Director of Radiation Oncology. I'm sitting up here on the third floor of the health campus. As for the past year, I've had the privilege of watching from this vantage point this incredible project take shape. Over my left shoulder, you can see the Proton building, which is now complete. We are thrilled to offer our patients, Lancaster, and really all of central Pennsylvania, this incredible technology which will transform cancer care. And when you add protons to what we currently offer, including the CyberKnife, the Halcyon, and 2 TrueBeams, I believe we are unique among community cancer centers anywhere in America for being able to offer our patients the latest technology in a beautiful, compassionate setting.
I am so excited to hear that Lancaster General Health is getting a proton radiation machine. Proton radiation really made all the difference for me back in 2013 when I was diagnosed with cancer. I am so happy and proud that Lancaster General is taking a leading role in helping patients that are just like me.
Welcome to the Penn Proton family.
Well, thank you, everyone. I hope you enjoyed that video from our guest today that we're commenting. I'm really excited to see this move forward. It's been a great day so far. I will say I already got comments today back from Randy and the team that the cookies were a hit that we sent out to Lancaster General and across our system for those that are working on site today and not virtually. If you haven't gotten one, look around our facilities. We have them out there. I'm really excited where this is going. We have a short video to share with you in a moment that will just show the pace of how the equipment came to the center and being entered into the center, which is pretty amazing. So take a few minutes to look at that. Randy, any last comments from you?
I would imagine that everyone is as touched as I am by the incredible outpouring of caring, expertise, and support from everybody who was pictured on the video. I think Kevin Mahoney hit the nail on the head when he noted that today we're talking about Proton, but this is really about an affirmation that the patients are at the center of everything we do across our health system. Thanks, Jim.
Always about the patients for us. So we're going to transfer now to this video. I hope you spend a couple minutes watching that, and I really look forward for us all getting together when we actually have the ribbon cutting when we treat the first patients. And thank you so much for joining us today.